Welcome to today's video about signs of colon cancer. Picture this. A 42-year-old teacher named Sarah felt slightly more tired than usual and noticed she was eating smaller portions. Nothing dramatic. Nothing that screamed emergency. 6 months later, she was diagnosed with stage 3 colon cancer. The signs were there all along, hiding in plain sight. Here's what no one tells you about colon cancer. It's a master of disguise. While everyone knows about blood in stool or severe constipation, this silent killer operates through 14 subtle warning signals that most people, and even some doctors, completely miss. These aren't the symptoms plastered on medical websites. These are the whispered clues that gastroenterologists desperately wish patients would recognize before it's too late. Some of these signs are so common you might be experiencing them right now, dismissing them as stress, aging, or poor diet. Today, we're exposing research from leading medical journals that reveals how colon cancer announces itself months before the obvious symptoms appear. By the end of this video, you'll possess knowledge that could literally save your life or someone you love. All right, let's dive into the list of silent signs of colon cancer, beginning with the first one: persistent iron deficiency anemia. The most overlooked red flag in colon cancer detection affects up to 75% of patients, yet most dismiss it as everyday fatigue. Iron deficiency anemia creates a staggering 31-fold increased risk of gastrointestinal cancer, according to research in clinical and diagnostic pathology. Here's the insidious process. Colon tumors bleed microscopic amounts daily, gradually depleting your iron stores over months. This isn't dramatic bleeding. It's invisible. Consistent blood loss that your body adapts to. So slowly you assume constant exhaustion is normal. Studies show 50% of colon cancer patients and 20% of rectal cancer patients develop anemia before surgery. The National Cancer Institute research reveals this bleeding is often too minimal for routine stool tests to detect, making it one of the most deceptive early warnings. What makes this particularly dangerous is the gradual adaptation. Your red blood cell count drops so slowly that you adjust to feeling constantly drained, attributing it to busy schedules or aging. Many gastroenterologists now consider unexplained anemia in adults over 50 as an automatic red flag, requiring immediate colonoscopy screening. Next, sign 2: chronic fatigue. Without clear cause, cancer-related fatigue differs dramatically from ordinary tiredness. Research from the Functional Assessment of Cancer Treatment studies shows this exhaustion affects patients even before chemotherapy, often indicating internal bleeding and tumor-induced metabolic changes. This isn't fatigue that improves with rest. Patients describe it as paralyzing, persisting regardless of sleep quality. The European Organization for Research and Treatment of Cancer found this exhaustion stems from inflammatory responses to cancer cells combined with iron deficiency. The danger lies in easy dismissal. Women blame hormonal changes, men attribute it to work stress. However, Annals of Oncology research demonstrates that baseline fatigue before treatment strongly predicts advanced disease. Cancer cells hijack nutrients and energy for tumor growth while triggering chronic inflammation that forces your immune system into overdrive. This metabolic disruption leaves you feeling constantly drained. The key distinction: cancer fatigue interferes with daily activities and doesn't respond to rest or lifestyle changes. If you've experienced unexplained persistent exhaustion for more than 3 weeks, especially over age 45, immediate medical evaluation is crucial. Next, sign 3: unexplained weight loss. Unintentional weight loss often gets celebrated rather than investigated, yet JAMA Network Open research involving 11,000 participants reveals significant weight loss. Without dietary changes can signal developing cancer months before other symptoms. Cancer cells are metabolically hyperactive, consuming enormous glucose and nutrients for rapid growth. Tumors release inflammatory cytokines that reprogram your metabolism, forcing your body to break down muscle and fat stores even with normal eating patterns. This weight loss typically affects muscle mass more than fat, leading to weakness and fatigue. Unlike intentional weight loss, cancer-related loss occurs despite maintaining normal appetite initially. Research indicates this can begin 6 to 12 months before typical colon cancer diagnosis. The gradual nature makes it particularly deceptive. Patients often don't notice until they've lost 10 to 15 pounds over several months. Family members frequently observe the change before patients do. Gastroenterology research institutes emphasize that losing more than 5% of body weight over 6 months without trying requires immediate investigation. If family members have commented on your appearance or if clothes fit differently without dietary changes, don't ignore these observations. Next, sign 4. Narrow or ribbon-like stools. While some studies question stool shape reliability, persistent narrow stools combined with other symptoms can indicate structural colon abnormalities. The key lies in persistence rather than occasional changes. When tumors grow within the colon, they create partial obstructions, forcing stool through narrowed passages. This mechanical compression creates characteristic pencil-thin or ribbon-like appearance. Gastroenterology research shows temporary changes are common and benign, but persistent narrowing over several weeks warrants investigation. Houston Methodist gastroenterologists distinguish normal variation from concerning changes. Diet, fiber, and temporary digestive issues regularly affect consistency. However, consistently thin stools lasting more than 2 weeks, especially with bowel frequency changes or abdominal discomfort, requires medical evaluation. Left-sided colon cancers, particularly sigmoid region tumors, more commonly cause shape changes due to narrower intestinal diameter. Right-sided cancers rarely affect stool shape because of larger diameter in those areas. If you notice persistent stool shape changes lasting more than 2 weeks, document the changes and discuss them with your healthcare provider. Next, sign 5. Ongoing bloating or gas. Persistent bloating affects 54% of colorectal cancer survivors, according to Women's Health Initiative research involving over 400 patients. Many attribute this to dietary choices, but it can indicate developing abnormalities. Tumor growth creates partial intestinal obstruction, trapping gas and slowing digestive movement. This leads to uncomfortable bloating and increased gas production that doesn't resolve with typical remedies like dietary changes or medications. Malignant bowel obstruction research shows that while complete obstruction occurs in advanced stages, subtle gas pattern changes and bloating can begin months earlier. Inflammatory responses around developing tumors affect intestinal motility, causing irregular gas movement. Cancer-related bloating differs from common digestive issues through persistence and progression. Normal bloating responds to dietary modifications, probiotics, or simethicone. Cancer-related bloating worsens over time and doesn't improve with standard interventions. The concerning pattern: daily bloating lasting more than 4 weeks that doesn't respond to elimination diets, probiotics, or over-the-counter treatments. If you've tried multiple approaches without relief, medical evaluation becomes necessary to rule out structural causes. Next, sign 6. Frequent urge to defecate. Without relief, tenesmus, feeling like you need a bowel movement even after finishing, specifically indicates rectal and lower colon cancer. This occurs when tumors create inflammation that tricks your nervous system into perceiving incomplete evacuation. Research shows tenesmus particularly affects patients with rectal and left-sided colon cancers. Tumor presence triggers stretch receptors in rectal walls, sending false signals that waste remains even when the rectum is empty. This creates frustrating cycles where patients feel urgent needs but produce little or no stool. The symptom develops gradually, initially occurring after normal movements but eventually becoming constant. Patients describe uncomfortable pressure or fullness that never resolves. Unlike diarrheal illness urgency, tenesmus persists when the bowel is empty. Studies show tenesmus combined with mucus production or minor bleeding strongly suggests endoscopic evaluation needs. The pattern becomes concerning when lasting more than 2 weeks without responding to hemorrhoid treatments. Early recognition leads to detection of rectal cancers at more treatable stages. If you experience persistent rectal pressure or incomplete evacuation feelings lasting more than 2 weeks, seek medical evaluation. Next, sign 7. Subtle abdominal cramps. Early colon cancer manifests as mild, recurring abdominal discomfort rather than severe pain. Gastroenterology research reveals cramping results from tumor-induced inflammation and mild obstruction without severe symptoms. This pain typically occurs in the lower abdomen as intermittent, dull aching rather than sharp pain. Partially obstructive tumors interfere with normal intestinal contractions, forcing intestinal walls to work harder, moving contents past obstructions. The deception lies in similarity to common complaints. Patients blame gas, diet, or stress. However, cancer-related cramping follows specific patterns, recurring in the same location, worsening after eating, not resolving with typical remedies. Positional changes sometimes provide relief as intestinal contents shift around partial obstructions. Developing tumors can irritate intestinal wall nerve pathways, creating referred pain patterns. The concerning timeline: recurring abdominal discomfort in the same location for more than 3 weeks, particularly if gradually worsening. Pain that interferes with sleep or daily activities represents a more serious pattern requiring thorough evaluation, including malignancy consideration. Next, sign 8. Changes in stool color. Stool darkening to tarry consistency indicates bleeding higher in the colon that may not be visibly apparent. When blood from ascending or transverse colon tumors mixes with digestive juices, chemical changes occur during intestinal transit. American Cancer Society research explains that right-sided colon bleeding allows blood interaction with stomach acid and enzymes, creating characteristic dark, tar-like appearance called melena. Unlike bright red rectal bleeding, this hidden bleeding continues for months unrecognized. Even small daily blood loss accumulates over time, leading to iron deficiency anemia. Color changes may be subtle initially, darker brown rather than dramatic black associated with severe bleeding. Patients often attribute changes to iron supplements, medications, or foods. The concerning aspect is intermittent bleeding that's easy to miss. Fecal occult blood tests can detect hidden bleeding even when visual changes aren't apparent. If you notice consistently darker stools unexplained by diet or medications, especially with fatigue or other symptoms, immediate medical evaluation is crucial for proper assessment and potential intervention. Next, sign 9. Unexplained nausea and vomiting. Nausea and vomiting typically signal tumor-created partial bowel obstruction, forcing digestive contents to reverse direction. Emergency surgery research shows this occurs when tumor growth significantly narrows intestinal passages. Disrupted peristalsis, rhythmic contractions moving digestive contents, creates pressure buildup behind obstructions, forcing contents backward and triggering nausea. This often begins subtly with mild post-meal nausea attributed to food sensitivities. Cancer-related nausea relates to eating patterns and shows progressive worsening. Patients develop early satiety, feeling full quickly after small amounts, followed by nausea as partially obstructed intestines struggle processing food. Timing provides diagnostic clues. Nausea several hours after eating suggests small bowel involvement, while immediate post-meal nausea indicates gastric issues. However, any unexplained nausea pattern lasting more than 2 weeks, especially with bowel habit changes or abdominal discomfort, requires investigation. The progression from occasional post-meal discomfort to more frequent episodes shouldn't be dismissed as stress or dietary issues when persistent and worsening over several weeks. Next, sign 10. Reduced appetite or feeling full. Quickly, early satiety, feeling full after small amounts, indicates developing colon cancer through multiple mechanisms. Oncology nutrition research shows tumor development triggers inflammatory cytokines that affect brain appetite regulation centers. These chemical messengers alter hormones like ghrelin and leptin that normally control hunger and satiety. Partial bowel obstruction makes small food amounts trigger fullness as digestive systems struggle processing contents normally. Cancer cells produce substances interfering with normal digestion and nutrient absorption, making bodies feel satisfied with less intake. This creates concerning cycles where reduced eating leads to weight loss and weakness. The gradual development makes recognition difficult. Patients don't notice changes until significantly reducing typical portions over months. Family members often observe changes first, commenting about eating less than usual. If you've lost interest in food or consistently feel full after eating half-normal portions for more than a month, medical evaluation is warranted. This symptom combined with weight loss or fatigue becomes particularly concerning and requires prompt investigation. Next, sign 11. Unexplained low-grade fever. Intermittent low-grade fevers represent subtle colon cancer manifestations, often dismissed as minor infections. Immunology research shows tumors create local inflammatory responses, triggering systemic temperature elevation even in early stages. Immune system responses to abnormal cancer cells cause this mechanism. Tumors release inflammatory substances and cellular debris activating immune responses, leading to periodic temperature elevation, typically 99 to 101 degrees Fahrenheit. This can be intermittent, occurring for days then resolving, returning weeks later. Cancer fevers differ from infectious causes through patterns and associated symptoms. They occur without respiratory symptoms, throat pain, or digestive upset typical of viral infections. They may include night sweats or general malaise, but lack acute onset and specific illness symptoms. These fevers often occur evenings or nights, following natural circadian rhythms but exceeding normal temperature variation. Persistence or recurrence over several weeks without identifiable causes becomes concerning. If you experience recurrent low-grade fevers for more than 3 weeks, especially with other subtle symptoms like fatigue or weight loss, comprehensive evaluation, including cancer screening, becomes important. Next, sign 12. Back or pelvic pain. Back and pelvic pain indicates tumor growth affecting surrounding structures, representing more advanced but still treatable stages. Pain management research reveals this occurs when tumors press against nerve pathways, particularly lumbar and sacral nerve roots. Direct pressure on nerve structures and inflammatory responses in surrounding tissues create this pain. Rectal and sigmoid colon cancers most commonly cause back pain due to proximity to sacral nerve plexus. Pain typically manifests as deep, aching sensations not responding well to typical pain relievers. Cancer-related back pain has distinct characteristics. Worse at night, doesn't improve with position changes, may accompany bowel habit changes or urinary function alterations. Pain interfering with sleep or daily activities represents concerning patterns. The progression often begins as intermittent discomfort, gradually becoming constant and severe. Pain may radiate down legs or include numbness if nerve compression occurs. Any unexplained back or pelvic pain persisting more than 4 weeks, especially in individuals over 50, requires thorough evaluation, including malignancy consideration for proper diagnosis and treatment planning. Next, sign 13. Changes in bowel habits that fluctuate. Alternating diarrhea and constipation patterns represent overlooked warning signs, often attributed to diet, stress, or irritable bowel syndrome. Gastroenterology research shows fluctuating patterns can indicate partial intestinal obstruction from tumor growth. Variable obstruction creates this mechanism. When tumors partially block colons, digestive contents accumulate behind obstructions, causing constipation. When pressure builds sufficiently, liquid stool squeezes past blockages, causing explosive diarrhea. Cancer-related bowel changes differ from benign conditions through persistence and progression. IBS symptoms typically respond to dietary modifications or medications. Cancer-related changes worsen over time without improvement from typical interventions. This alternating pattern develops gradually over months, initially occasional but becoming frequent and severe. Changes may include abdominal cramping, bloating, or incomplete evacuation sensations. Patients describe fundamental changes from lifelong patterns. If you've experienced significant bowel frequency or consistency changes alternating between extremes for more than 6 weeks, particularly over age 45 or with family history, medical evaluation with potential colonoscopy becomes crucial. Next, sign 14. Skin pallor or yellowing. Subtle skin color changes represent late-stage warnings often unnoticed until pronounced. Hematology research shows chronic blood loss causes gradual pallor, while liver involvement triggers early jaundice symptoms. pallor results from chronic iron deficiency anemia. When blood loss occurs slowly over months, bodies adapt by reducing red blood cell production and redistributing remaining cells to vital organs, leaving skin and mucous membranes increasingly pale. Yellowing occurs when colon cancer spreads to liver or large tumors compress bile ducts. Even minimal liver involvement can disrupt bile processing, leading to subtle yellowish discoloration in eye whites or skin. The gradual onset makes these changes particularly concerning. People adapt to slow changes while others notice differences more readily. Changes often affect eye whites, nail beds, and palms before becoming generally apparent. If friends or family comment on your appearance, noting you look pale, tired, or different, don't dismiss this feedback. These observations, combined with other symptoms, provide crucial diagnostic information requiring medical attention. These 14 silent signs represent your body's early warning system, desperately alerting you to developing problems before they become life-threatening. Research consistently shows early detection dramatically improves survival rates, exceeding 90% when caught early versus less than 15% after spreading. The crucial point: these symptoms rarely occur alone. Cancer typically creates multiple subtle changes simultaneously. You might experience mild fatigue with occasional bloating and slight bowel habit changes that individually seem insignificant, but collectively paint a concerning picture. The tragedy lies in dismissal and delay. Studies show early-stage patients often recall symptoms for months before seeking attention. Average delay between symptom onset and diagnosis ranges from 6 to 12 months, time when early-stage disease can progress significantly. Current screening guidelines recommend colonoscopy at age 45, but symptoms at any age warrant evaluation. Family history, inflammatory bowel disease, and lifestyle factors should lower your threshold for seeking medical attention. Trust your body and advocate for yourself. If something feels different, persistent, or concerning, pursue medical evaluation even if initially dismissed. Request specific testing if symptoms persist or worsen. Remember, early-stage colon cancer is highly treatable, often requiring only minimally invasive surgery with excellent outcomes. Recognition and action before severe symptoms is key. If this video helped you understand these warning signs, kindly type "helpful" in the comments. That motivates us to create more life-saving content. Please like this video to help it reach others who might be experiencing these symptoms unknowingly. Share it with family and friends, and subscribe for more essential health insights. Thank you for learning about these critical warning signs. Your awareness could truly save a life.